Good morning. My name is Lisa Howley, and I'm delighted to be here with all of you this morning and be a part of this dialogue. I am here from the Association of American Medical Colleges, and I want to start out by telling you a little bit about my association, and then, of course, some of the work that we're doing in this space. The mission of the association is to serve and lead the academic medicine community for the health of all. We were founded in 1876, and we're based right here in Washington, D.C. We're, of course, a nonprofit association dedicated to transforming healthcare through medical education, research, and patient care. Our members are all now 154. As of 2 weeks ago, we added 2 more schools. 154 U.S. medical schools, 17 Canadian schools, as well as nearly 400 major teaching hospitals and health systems, including 51 VA medical centers and 80 academic societies. Through these institutions and organizations, we serve, of course, the leaders of medical schools and teaching hospitals, but importantly, there are more than 170,000 full-time faculty members, 90,000 medical students, 130,000 resident physicians, and more than 60,000 graduate students and postdoc researchers in biomedical sciences. We are a member service organization, and I think it's worth noting that unlike my colleagues to my right, we do not regulate practices or set standards. We are not an accrediting body. Although we certainly work closely with the accrediting bodies within the House of Medicine, again, we are not the accreditor, so we have a little bit of a different relationship with our members. Probably putting it mildly. But we have a unique relationship with our members. One is it's very supportive and formative and developmental with them. We're extremely dedicated to the issues of health equity, community and population health. For example, our most recent annual leadership forum, we focused on community engagement to combat health inequities. Reducing the health disparities that affect so many of Americans requires that our medical schools, teaching hospitals invest in building really bi-directional trust, developing meaningful relationships, and understanding the historical perspectives of the community members that they serve. Although my association is actively engaged in population public health research and clinical practice and innovations in that space, my focus is education. I'm an educational psychologist by training, and I work within our division of medical education within the association. So my remarks, I'm going to share with you just a couple of examples specific to that domain. To begin, we've heard a fair amount already about competency-based education, and certainly over the last several decades, higher education, including that medicine, has shifted to a competency-based model. We recently released new competencies in quality improvement and patient safety, and health equity is one of those 5 domains. These were developed over a course of 18 months with broad stakeholder input and community collaboration, and we are intending for these to aid in curricular design and in the assessment of competence across the continuum of medical education for medical student, resident, and physicians in practice. We also recently partnered with the Provider Training and Education Work Group led by Drs. Don Bradley and William Dietz, which was an ad hoc activity of the Roundtable on Obesity Solutions within the National Academies. We developed core interprofessional competencies for obesity prevention and management, and we're working to extend improvements in nutrition and physical activity education to other health profession schools, in addition to medicine. For the last 20 years, we've had an interprofessional cooperative agreement with the Centers for Disease Control that is focused on enhancing population health education and providing experiential opportunities for medical, nursing, and public health students. This work is actually led by my colleague, Dr. Malika Fair, and includes several activities, too many that I can mention right now, but just to give you a few examples, we offer a free web-based directory known as Public Health Pathways, which you may be familiar with. Includes over 200 domestic and international public health training opportunities for learners, again, across the education continuum and across professions. This year, that team will be publishing a monograph featuring residencies. So this is graduate medical education residency programs featuring lessons learned and best practices in effectively teaching and modeling population health management in a primary care training setting. And in May, we'll be hosting a national workshop for educational leaders across the continuum from all U.S. medical schools to advance medical education to combat opioid misuse. here actually in the DC area. Health inequities in pain, addiction, and prescribing, as well as the impact of bias and stigma on care delivery, will be a major focus of that event. Our MedEd portal is a peer-reviewed publication that's open access and promotes educational scholarship and dissemination of teaching and educational resource materials. We actually have a special collection that I hope you're familiar with, but if not, please see us online and check that out. It's the featured collection is on diversity, inclusion, and health equity. It's co-sponsored with the American Dental Education Association, includes numerous publications that address an array of issues from food insecurity, community and home violence, cultural humility, obesity care, homelessness, and school health. So I'd be remiss, finally, not to mention a very rich portfolio within our Scientific Affairs Division, which is led by Dr. Philip Alberti and supported by the AHRQ and the CDC. It's referred to as Accelerating Health Equity, Advancing Through Discovery. It seeks to identify, evaluate, and disseminate effective and replicable AMC member institution practices who are improving community health and reducing health inequities. Dr. Carrie Sutton supports this work as the Director of Health Equity Research Workforce and is here with us today. I'm sure she'd be willing to share information with you. So finally, in closing, I just want to thank you for the opportunity to be with you today. We believe that improving population health, promoting healthcare quality are critical responsibilities for physicians and requires an educational program that is competency-based and designed to mutually benefit the local needs of the academic health system and the communities within which they serve. So thank you.